Poverty and the basic sanitation crisis in Latin America. A challenge to fundamental rights. Poverty, basic sanitation, fundamental rights, social inequality, public policies. Introduction. The contextualization of the serious reality of poverty and lack of basic sanitation in Latin America according to the National Basic Sanitation Survey reveals that the country needs to invest in basic sanitation, since only 60% of households on average have sewage disposal, that is, approximately 40% or more of households in Latin America dispose of sewage without collection and adequate treatment. This survey demonstrates the magnitude of the problem. It is very important and timely to emphasize that there is success in other areas of public service, such as 98% of households with electric lighting and 90% of households with internet access. The relevance of the topic is highlighted by the importance of basic sanitation as a fundamental human right, essential for health, dignity, quality of life and social and economic development. Objective. The objective of this research is to present the need for investments in the area of basic sanitation in Latin America, where the intrinsic relationship between poverty and lack of sanitation proves the sectoral lack of compliance with fundamental rights and the need for effective public policies. Material and methods. The research highlighted various aspects, including the existing infrastructure, the challenges communities face, and the impact of inadequate sanitation on public health throughout the region. The findings underscore the urgent need for improvement. In conclusion, this comprehensive examination reveals that basic sanitation remains a critical issue in Latin America, requiring immediate and sustained efforts for reform to enhance overall public health and quality of life for its residents. Results. Basic sanitation is recognized as being of utmost importance for the dignity of the human person, meeting the fundamental precepts of UN human rights. Impacts of the lack of sanitation on health and the economy due to the proliferation of infectious diseases, diarrhea, worms, leptospirosis, etc., which mainly affects children and low-income populations. The direct economic costs with health treatment and indirect costs such as loss of productivity and school absenteeism contribute to perpetuating the cycle of poverty. Due importance should be given to the sensitive aspect of the impacts on human dignity, since the lack of access to adequate sanitation facilities and sewage collection affects the dignity, privacy and safety of people, especially women and children. Conclusion. The challenges and obstacles to the universalization of basic sanitation in Latin America demonstrate the importance of adequate investment, the creation of tools to deal with the bureaucracy of bidding processes, reducing regional inequality and the need to integrate social and sanitation policies. The importance of implementing integrated public policies that simultaneously address the fight against poverty and the lack of basic sanitation is demonstrated, with a focus on disease prevention, health education and improving the living conditions of vulnerable populations.